Now, for more, let's go to Dr. Mohammed Munir. He's a virologist at the Lancaster University in the UK. Welcome to the program. Now, this vaccine won't be available en masse for months, but when it is, it will have to be stored and transported at ultra cold temperatures. How geared are different countries to be able to do that?
Well, thank you very much, Mobin, for having me on the show. I think this is one of the major challenges in transportation for this vaccine, because the temperature maintenance, not only just for the storage, but also starting from the factory exit until it is getting into the human veins, it has to be maintained 80 Celsius below zero, which is really quite a bit of challenge, because most of the surgeries, most of the hospitals, they have freezers which are minus 20, and maintaining minus 80 Celsius temperature is really a big challenge. I mean, in the laboratory, we do maintain minus 80 Celsius temperature, but for that, we do need dry ice, which requires carbon dioxide in a frozen version, or liquid nitrogen, and both of them are really in shortage. So one of the major challenges for this vaccine would be really the storage and transportation at cold chain.
Now, as to the question of who should get the vaccine first, there is agreement that at-risk populations like the elderly, healthcare workers should be. But if we look in terms of countries, really, is there a case for some countries to get it before others, considering that they have more cases?
I think this is really one of the next challenges, how the equitable distribution will be made. But the part of the problem is that most of the wealthy nations, they already have pledged the doses. For example, here in the UK, we already had to deal with the Pfizer for 40 million doses. And I think the Pfizer capability for this year is only 50 million. So it would be really a question whether the frontline health worker or vulnerable communities would get the first, or the one who have already pledged the doses will get the first. And my anticipation is that I think the first round of consignments would be to the one who have already pledged, before really looking into who need it the most. But it should, in principle, be other ways around, because until nobody is safe, no one is really safe. We have to make sure that person who is at the vulnerable position should be vaccinated than the person who have the money to do that.
Now, we've had some good news from Pfizer, but other vaccines are hitting roadblocks. Eli Lilly, the Chinese vaccine trial in Brazil being halted. How important is it to have more than one vaccine available?
Well, Nobin, I think this is a really important question. Although Pfizer's initial interim results are really encouraging, but even if it is approved at the end of this year, it would not meet all the demands that we require around the world. We need at least 2 or 3 vaccines. Those are based on different technologies, because each technology itself has its own shortcomings. So, for example, AstraZeneca is based on adenovirus vaccine that require different capability for scaling it up. And the Pfizer's or Moderna, these are mRNA-based vaccines. These require different infrastructure. So we need more than 2 or 3 vaccines to really reach to the point where we will be able to immunize 70% of the world population. And when we talk about 70% world population, we are talking about 11 billion doses, given all of the vaccine would require 2 doses to immunize. And this is a big ask and very big undertaking. So it's certainly a lot more challenges on the way.
Now, until that time that we have a vaccine available for everyone, though, in the meantime, we're seeing record rise in cases in the US, in many European countries. How satisfied are you with what governments in those countries, in those regions, are doing so far to contain the virus?
I think one of the problem has been with such type of infectious diseases that is a lot more infectious than we initially anticipated. That gave us very little time to prepare. But I think after the first lockdown, most of the governments, they have understood, they have learned what are the infrastructure that are required to curtail this infection, and what are the strategies that need to be adopted to really adopt before we can claim any benefit out of it. So as it stands now, one of the problem what I've been criticizing about that is that we didn't really have a consolidated and collected effort, even in this small continent of the Europe. Because although European Union is there and many countries do work together when it needs to be, but when it came to the pandemics, we didn't see really a collected effort. It would be more national rhetoric, and that had led to a lot more consequences that we would have otherwise.
Thank you so much for your input. Always glad to have you on the show, Dr. Mohammed Munir there from London. Now, still ahead here on